So welcome back to my channel. Today we are going to be talking about specific pneumonia, and this is going to be taking us a little time. Please like my video, subscribe to my channel, and share with your friends. Thank you. Specific pneumonia, pneumococcal pneumonia overview. The commonest bacterial pneumonia affect all age. Common in elderly, alcoholics, post-splenectomy, the immunosuppressed, or those with chronic heart failure or pre-existing lung disease. Clinical features is fever, pleurisy, herpes labialis. What you can do is the chest x-ray, which is going to show a lobar consolidation. Diagnosis is to check for urinary antigen if moderate to severe, and the treatment is amoxicillin, benzyl penicillin, or cephalosporin. For staphylococcal pneumonia overview, it may complicate influenza infection because it can occur in the young, in the elderly, in people who use intravenous drugs, IV drug users, or patients with underlying disease like leukemia, lymphoma, or cystic fibrosis. The causes bilateral cavitating bronchopneumonia. So bilateral on chest x-ray, bilateral cavitating bronchopneumonia is what you see for a chest x-ray with staphylococcus pneumonia. And treatment is flucloxacillin plus or minus rifampicin. If there is methicillin resistant staphylococcus aureus, you contact the lab, send samples to the lab, and consider adding vancomycin to your treatment. Klebsiella pneumonia is rare. Klebsiella pneumonia is rare, occurs in elderly, diabetic, or alcoholics. Causes a cavitating pneumonia in the upper lobe. So the chest x-ray is going to show cavitating pneumonia in the upper lobe if it is Klebsiella pneumonia, often drug resistant. What do? You treat with cefotaxime or imipenem. For Pseudomonas pneumoniae, a common pathogen in bronchiectasis or cystic fibrosis. Pseudomonas pneumoniae is a common pathogen in bronchiectasis and cystic fibrosis. Also cause hospital-acquired infection, particularly in intensive care unit, I would say, or post-surgery. So the treatment for a pseudomonal pneumonia is anti-pseudomonal penicillin, ceftazidime, meropenem, or ciprofloxacin plus aminoglycoside, and consider inhaled therapy to minimize resistance. For Mycoplasma pneumonia, the epidemic occurs every 4 years. It presents insidiously with flu-like symptoms of headache, myalgia, arthralgia, followed by a dry cough. The chest x-ray will show a reticular nodular shadowing or patchy consolidation. Diagnosis is to do a polymerase chain reaction of the sputum or serology. Sputum serology. Cold agglutinin may indicate autoimmune hemolytic anemia. Complications include skin rash, erythema multiforme, Stevens-Johnson syndrome, meningoencephalitis, or myelitis, Guillain-Barré syndrome as well, are all complications of Mycoplasma pneumoniae. Treatment: clarithromycin 500 mg 12 hourly or doxycycline 200 mg loading and 100 mg per day. Fluoroquinolone can also be added to treat Mycoplasma pneumoniae. Fluoroquinolones like your ciprofloxacin or norfloxacin. Legionella pneumoniae. Overview: colonizes water tank kept in temperatures less than 60 degrees Celsius, e.g. hot air conditioning. Flu-like symptoms include fever, malaise, myalgia, precede dry cough and dyspnea. Extrapulmonary fixtures include anorexia, diarrhea or vomiting, hepatitis, renal failure, confusion, and coma. Chest X-ray shows a bibasal consolidation. Diagnosis is urine antigen or culture. Treatment is fluoroquinolone for 2 to 3 weeks or clarithromycin 10% mortality. Chlamydophila pneumoniae. Overview: commonest chlamydia infection spread from person to person. Bibasal illness, biphasic illness, pharyngitis, hoarseness, otitis followed by pneumonia. Diagnosis is chlamydophila complement fixation test. Chlamydophila complement fixation test. Treatment is doxycycline or clarithromycin. Chlamydophila psittaci. Overview: causes psittacosis and onychosis acquired from infected birds, typically parrots. Symptoms is fever, headache, dry cough, lethargy, anorexia, diarrhea, or vomiting. Extrapulmonary features is the endocarditis, hepatitis, nephritis, splenomegaly, or meningoencephalitis. Diagnosis is chlamydophila serology. Viral pneumonia. Influenza is the commonest cause. Swine flu H1N1, now seasonal, covered by annual flu vaccine. Others are measles, cytomegalovirus, varicella zoster. Pneumocystic pneumonia affects the immunosuppressed. Examples are the human immunodeficiency virus, HIV, previously Pneumocystis carinii, now called Pneumocystis jirovecii. Presents with dry cough, exertional dyspnea, fever, bilateral crepitation. Chest X-ray will show normal or bilateral perihilar interstitial shadowing. Diagnosis is visualization of organism via bronchoalveolar lavage or lung biopsy. Treatment is high-dose cotrimoxazole or pentamidine intravenous for 2 to 3 weeks. Steroid if severe hypoxemia. Prophylaxis indicated if CD4 is less than 200 per millimeter cube after the first attack. Thank you very much. So let's go to the question for this.